the principles and practice of computed tomography scanning. Welcome to the Everything Surgery podcast. Today we delve into the fascinating world of medical imaging and, in particular, the technology of computed tomography scanning. This episode will explore its underlying principles, its clinical uses, the benefits and risks associated with this procedure, as well as what a patient can expect throughout the process. Let us begin with the basics. A computed tomography scan, also known as a computed axial tomography scan, is a sophisticated medical imaging technique that utilizes a series of X-ray images taken from multiple angles around the human body. With the aid of advanced computer processing, these images are synthesized to form detailed cross-sectional views of bones, blood vessels, and soft tissues. Unlike a traditional X-ray, which presents a composite image where structures overlap, a computed tomography scan allows clinicians to see inside the human body with remarkable clarity, isolating organs or abnormalities as though slicing through layers for precise visualization. Now, how does this technology operate? At its core, the process involves an X-ray source and detectors that rotate around the patient, who lies on a motorized table. The patient is drawn into a large circular device known as a gantry. Within this apparatus, the X-ray tube and electronic detectors revolve around the body, capturing images one slice at a time. Each rotation records how much radiation is absorbed by different tissues. Bones absorb more radiation, while soft tissues absorb less. This data is sent to a computer which then, using complex mathematical techniques, reconstructs the slices into highly detailed images, both two-dimensional and three-dimensional. In modern computed tomography scanning, the X-ray tube traces a continuous spiral as the table moves, enabling rapid and precise scanning. Computed tomography scans are renowned for their versatility. They are employed in a wide range of diagnostic and therapeutic settings, such as identifying infections, cancers, and other medical conditions. In emergency rooms, computed tomography scans are often the first choice for evaluating internal injuries, bleeding, and fractures following accidents. Surgeons use them to guide procedures such as biopsies and radiation therapy with exceptional accuracy. Additionally, computed tomography scans help monitor the effectiveness of treatments, such as observing changes in tumor size during chemotherapy. Clinicians also use them to detect internal bleeding or blood clots, such as those occurring in the brain or abdomen. For certain high-risk populations, computed tomography scans can be used for cancer screening. For example, in the early detection of lung cancer among chronic smokers. Let us discuss the procedure itself and what patients can expect. Preparation for a computed tomography scan may include fasting for a few hours, especially if a contrast agent will be administered. Patients are usually asked to change into a hospital gown and remove any metal objects, including jewelry, glasses, or dentures. In some cases, a contrast agent is used to enhance certain areas of the body. This may be delivered orally, intravenously, or, less commonly, by enema, depending on the area being examined. If an intravenous contrast is used, the patient might experience a warm sensation or a metallic taste for a brief moment. During the scan, the patient lies on a narrow table which moves slowly into the center of the scanner. The technologist operates the machine from an adjoining room, maintaining visual and audio contact at all times. It is important for the patient to remain very still and, at times, hold their breath to ensure the images are clear and not blurred. The machine emits whirring and buzzing sounds as it rotates, but the process itself is painless and typically concludes within 5 to 20 minutes. After the scan, most patients can resume their normal activities immediately. For those who received a contrast agent, drinking extra water is recommended to help the kidneys flush out the substance. Now, let us weigh the benefits against the risks. Among the most significant advantages are that computed tomography scanning is non-invasive, causes no pain, and provides exceptionally detailed and accurate images in a very short time, something that is critical during emergency situations. These scanners are widely available in hospitals and clinics around the world. However, there are considerations to bear in mind. The primary concern is exposure to ionizing radiation, which is higher than that of a single standard X-ray. Medical professionals carefully balance the diagnostic benefits against the small potential risk of increased cancer likelihood later in life, especially for younger patients. There is also a risk of allergic reaction to contrast agents, most commonly those containing iodine. Although such reactions are rare and generally mild, Pregnant women are advised to avoid computed tomography scans unless absolutely necessary, as there is potential risk to the developing fetus. In these cases, ultrasound or magnetic resonance imaging is preferred. For certain soft tissue concerns, such as ligament injuries or brain tumors, magnetic resonance imaging can provide even greater detail without radiation exposure, although it is more costly and takes longer. In summary, computed tomography scanning stands as a cornerstone of contemporary medicine, revolutionizing our ability to diagnose and treat a multitude of conditions with speed and precision. Physicians ensure that each scan is performed with careful consideration, always weighing the necessity and benefits for each individual patient. Thank you for joining us for this in-depth discussion. We hope our exploration has provided you with a clear understanding of computed tomography technology, its workings, its place in modern healthcare, and its impact on patient care. Until next time, it's the Everything Surgery Podcast. Dissect the extraordinary.